Welcome to the maiden edition of Health Vanguard with Maryjane. Today, I'm going to be discussing a very important topic. I'm going to be joined by a very important guest by name, Dr. Lizzie. Dr. Lizzie is a fashion model and a medical practitioner. She's going to be making some contributions as regards the topic. On today's talk show, we're going to be discussing on the deplorable state of healthcare system in Africa. My name is Uda Maryjane, and I'm your host on this health talk show. Stay tuned.
Deplorable state of the healthcare system in Africa. Now, as a medical doctor, I know how much dedication and motivation it takes for me to come to work every day. The healthcare system has been bad for years. Now, it's sad that it takes a global pandemic for us to really appreciate how bad the healthcare system actually is. There's so many challenges I face as a healthcare worker, and if I choose to talk on all of them, our time will be exhaustive. So I'm just going to name a few of them. The poor salary and poor insurance for healthcare workers, being overworked due to the bulky patient load and the very few functioning hospitals, poor access to technology like basic CT scan, MRI, internet services, poor access to personal protective equipment that reduces our exposure to hazards, poor organization in the hospital, being understaffed because there's so many doctors who are capable and actually looking for jobs, but still the hospital generally is understaffed. So those are practically the most important challenges I go through.
Let's bring it home a bit. Who is really to be blamed when it comes to the dilapidated system of healthcare in Africa in general, not just Nigeria? Who is to be blamed?
We all are to blame, believe it or not. The government, the citizens, the healthcare workers, everybody, we have a role to play in how bad the system is. Majority of this blame obviously goes to the government because the hospital is broke, the hospital is poor, and the government needs to allocate more funds to the hospital for us to be able to work. And because of this lack of funds, we don't have anything to work with. We don't have there are no ways to provide adequate services for people who actually need it. If we don't have what to work with, even the doctors, we are not insured. We don't have our salary. They're very poor. It doesn't even motivate us to work. Those are so many reasons the healthcare system is the way it is right now. People are just taking the money, instead of pushing it into the healthcare system so we can work better and provide adequate services to people. One of the things we can actually do to make things better in the hospital is to allocate funds. We need money, we need to pay staff, we need technology, we need more equipment for doctors and healthcare workers because we can't keep risking our lives, putting our lives out there for people we don't know. We have families as well. We're not even insured.
Wow, it's been an amazing session with you, Dr. Lizzie. Thank you so very much.
Thank you, Maryjane, once again for inviting me to talk on this very sensitive topic. I really enjoyed myself.
Stay tuned till I come your way next time. It's been your host, Maryjane. Bye.